Good afternoon, everyone. As we strike noon, I'll begin our webinar. My name is Mark Butekoffer, and I am the Director of Advancement within the University Advancement Communications here at the University of Regina. I'd like to start by acknowledging that we are here virtually on Treaty 4 territory, the traditional territory of the Cree, Saulteaux, Dakota, and Dakota peoples in the homeland of the Métis. University Advancement, together with the University of Regina's Lifelong Learning Center, has been offering the Research with Impact series to alumni for the past 3 years. And now we're pleased to be able to continue this series virtually, and so grateful that you joined us today. To those joining us for the first time, or potentially for your fourth time, welcome. In case you missed it or would like to see the previous presentations again, we've posted our third lecture, Dr. Child's May 26th talk on legal cannabis in Saskatchewan and Canada on YouTube. You can access it from the university's Alumni and Community Engagement webpage, which I believe will be on the screen. Our 3 sessions in May were such a success that we've added 3 more lectures for the June version of our Research with Impact virtual series. And with us today for our 4th lecture in this series are nearly 40 people from cities and towns throughout the province, Saskatchewan, and around the world. As you know, June marks the university's annual spring convocation, but because of the pandemic, it's also the first time in our university's history that we won't be gathering in person to celebrate our graduates' achievements. But the absence of a ceremony in no way diminishes our graduates' years of study as they join the ranks of our 79,000 alumni. And we have several important virtual projects to celebrate our graduates' achievement, including a video recognition of our students, a virtual yearbook, digital swag, virtual ceremonies within the faculties, and more. I am pleased to share that the Research Office continues its slow and steady 4-phase back to research plan, aligning with the province's phased-in Reopen Saskatchewan plan. As of yesterday, June 8th, the university moved into phase 2 of its back to research plan. Phase 2 builds on the foundation laid in phase 1 and will accommodate human participant-focused research activities in addition to the lab-based phase 1 reopening. And now, I'd like to introduce our 4th speaker in the University's Regina's Research with Impact virtual series, Ms. Amy Zarzeczny. Amy is an associate professor with the Johnson-Shoyama Graduate School of Public Policy, University of Regina campus, where she teaches courses in health law, health policy, and healthcare organization and administration. She holds a Bachelor of Laws from the University of Alberta, as well as a Master's of Law from the London School of Economics and Political Science. Ms. Zarzeczny's research focus on health law and health policy issues, including legal, bioethical, and policy challenges associated with emerging biotechnology, unproven and experimental medical interventions, and medical tourism. Her research has been funded by the Canadian Institute for Health Research, Genome Canada, and the Saskatchewan Health Research Foundation, and the Stem Cell Network. Today, we are talking about stem cell research, navigating the promise of innovation and the perils of premature application. Stem cell research has the potential to improve a variety of medical conditions, but carries incredible risk. Amy will look at the tension between creative effective policy and the need to provide better research resources for potential patients and their loved ones. Welcome, Amy.
Thank you very much for that introduction, Mark, and for the opportunity to present here today. I feel very fortunate to be a faculty member at the University of Regina, and I'm excited to have this opportunity to share some of my research with our broader community. Our agenda for today is as follows. I'm going to start by providing a bit of a background or lay some foundation for the discussion by briefly touching on what stem cells are, providing some context and a bit of an overview for the market for unproven stem cell-based interventions. And this really flows from work that I've been involved with over the last number of years. I'll then segue into presenting some very recent research results from research I've been doing in collaboration with scholars from the University of Edinburgh and from the University of Melbourne. And so we'll be looking at some of our recent findings, including what patients' voices tell us about some of the necessary policy work that needs to be done in this space. As was mentioned in the introduction, we'll also have some time at the end for questions and discussion, and I look forward to your thoughts at that point. We talk about stem cells often very broadly, but what do we mean? What is a stem cell? And as Mark noted in his introduction, I am a lawyer, not a scientist, so this will be very sort of high level. The important piece about stem cells that makes them so valuable from a research perspective and ultimately, hopefully from a clinical perspective, is their ability to replicate themselves and to what's called differentiate into many different cell types. So to become different kinds of cell types in the human body. Now, although we use often hear anyway, the phrase stem cells or those two words used in a fairly general sense, there are indeed many different kinds of stem cells and different sources, and they can do different things. So not all stem cells are created equal. For example, we can have adult sources of stem cells that may come from muscle tissue. Those are what's called multipotent in that they're somewhat restricted in the kinds of cells that they can produce. They can produce those of like kinds. So another example, a blood stem cell, a hematopoietic stem cell that's taken from bone marrow, for example, can become red blood cells, white blood cells, platelets. It cannot become neural tissue or cartilage or heart tissue. A familiar form of stem cells you've likely heard about is embryonic stem cells, and they are often considered the gold standard for research because they are pluripotent in that they can give rise to all the different kinds of cells in the human body. So we don't need to worry about the specifics for our purposes today, other than to just be aware that there are many different kinds of stem cells, and again, they can do different things, which has different implications for what we hope to be able to do with them when it comes to treatment. The hope around stem cell research and regenerative medicine is that it will ultimately lead to improved treatment options for a wide range of conditions. We already have a few very well established and very successful kinds of stem cell-based interventions. Bone marrow transplants for leukemias and other blood cancers are one example that many of us are familiar with. But at this stage, many other hoped-for treatments are still in early phases of research. It's the regenerative potential of stem cells that gives them their promise. So it's that hope that we may be able to harness that power of stem cells to repair or replace damaged tissue. So for example, if we have heart damage, that we'll ultimately be able to use stem cells to repair that damage so that we have healthy tissue again. But controlling stem cell differentiation is a very complicated task, and it is something that requires rigorous research and robust study. It's something that demands a long game when it comes from the scientist's perspective and that view to clinical translation. So again, lots of promise in this field, but it is not a smooth road to the clinic, and a lot of research needs to be done before we can achieve safe and effective therapies. However, it's that potential around stem cell research that has really gotten people excited. Ever since the first stem cell lines were derived in the late 1980s by some Canadian researchers who had some very exciting leadership roles in the field, we've had a lot of enthusiasm in public domains around stem cells. They're in public communications, they come up in books, in movies, and TV shows. I will admit to the guilty pleasure of watching Grey's Anatomy, and yet being somewhat bemused when every couple of years they seem to be able to regenerate an entire organ using stem cells, often in the course of one episode. So as we know in many other areas, representations in popular culture of science, while often highly entertaining, are not necessarily terribly realistic. These kinds of representations run alongside media reports of stem cell breakthroughs that are often glowing in the way that they're framed. We hear language like cure, miracle, breakthrough. These headlines are captured from well over a decade, and yet unfortunately we still don't have a cure for Parkinson's or for paralysis. The level of enthusiasm with which research findings and research progress are presented in popular culture and in the media has risen to a point that it's routinely referred to as hype by many commentators and academics who work in this space. So it's sort of, again, that really enthusiastic, often not terribly specific ways of representing the progress in this field that is, as I mentioned, promising and yet often very complex. And much of the research is still in early stages, yet when we hear about it in popular culture or in media, it's often presented as being further along, or at least certainly that seems more reasonable. Research has been done on the language that's used around how we frame expectations for clinical readiness. So in other words, what is it when we sort of have that question, well, when will this be ready for clinical use? When will I be able to get this therapy? We often see that 5 to 10 year framework being used, whether it's in media reports, whether it's from university press releases or lab scientific statements. And yet we've been hearing 5 to 10 years for quite some time, which again doesn't, I think, take away from the ultimate likelihood that many of these avenues of research will ultimately lead to improved therapies. But what it does do is highlight how complex this field is and how much, again, robust work is required to get us there. So what all of this, I think, does, sort of on the one hand, we have the sort of complex science that's required in the lab. We also then have this sort of confusing information environment can lead to sort of a disconnect between public expectations around what we should be seeing from a treatment side of things. I think a really useful example of this is drawing on the field of multiple sclerosis, or MS. Unfortunately, this is an area all too familiar for many of us here in Saskatchewan because we have one of the highest prevalence rates in the world. There is some very exciting and promising research going on when it comes to MS as a potential treatment, or sorry, for stem cells as a potential treatment for MS. Here, the pieces I've shown here are led by Dr. Harold Atkins from the Ottawa Hospital, someone I've collaborated with. He's fantastic. He's led some really groundbreaking clinical trials in this area. The woman pictured here to his right, the left on the screen is Jennifer. She had early onset aggressive MS and was one of Dr. Atkins' clinical trial participants who had a really positive outcome from that trial. But this work is very similar to a bone marrow transplant in that it involves destroying a patient's immune system through high doses of chemotherapy, followed by a stem cell transplantation and immune suppression, all of which is incredibly dangerous, very difficult, very painful, and a very long process. One of the 24 patients in the trial died from complications as a result. So promising research, but very high stakes as well. I contrast that with some of the direct-to-consumer, private market, unproven interventions that are offered for multiple sclerosis that you can find worldwide. And often these are portrayed as being just 2 or 3 days, a few infusions, while you can have a spa treatment afterwards. They're not the same thing, of course, as the work that's being done by Dr. Atkins' lab. And yet, for someone who is looking for desperate hope in these circumstances, it's not always clear that there is a difference between those, or certainly that one is sort of the likely success of one versus the other, especially when one is broadly accessible and that you can go online yourself, you can make an appointment, you can book your flights and you can travel there, at least in pre-pandemic times, versus clinical trials, which can be very restricted in terms of their enrollment and often sort of a very limited exposure. So that's just one example to sort of show that sort of the differences between what we can have available in the private market versus what's happening on the legitimate science side of things. Now you can Google stem cell treatment for any number of conditions and find clinics worldwide who are willing and advertising services to treat them. Just a few very quick examples of the spectrum of services on offer. We have everything from anti-aging treatments to treatments for ALS, or which of course is a very serious degenerative, ultimately fatal condition for which there is no known cure, as well as sort of really everything in between. This particular clinic offers services, treatments for ALS, COPD, all the way to heart failure, kidney disease, the aging again, Lyme disease, lupus, neuropathy, Parkinson's, spinal cord injury. Really, the list goes on. And all for what perhaps is considered a bargain price, I'm not sure, of $20,000 US. And this is, again, just one example. So there are sort of innumerable options available on these private markets for these interventions that have not been established to be safe or effective through sort of any of the regular research protocols that we would typically see with respect to our medical treatments that are offered as part of standard of care. Now, there aren't as many, you may not come across as many clinics through traditional searches as you would have a year ago, because in 2019, Google actually, in response to sort of fairly strong levels of pushback and concern around marketing of these services, issued a policy where it was attempting to curb some of the marketing for these unproven stem cell therapies, recognizing that they can be dangerous and that there are concerns, and trying to limit some of that direct-to-consumer online availability. But it's not a flawless system. It doesn't address marketing through other social media mechanisms. YouTube, for example, is becoming a particularly widely used venue, also Twitter, Facebook. It doesn't address other search engine options. And all of the screenshots I just showed a couple of moments ago, I just found last week. So it's clearly sort of, it's not a foolproof system, but some viewed it as a very positive step forward, although not, of course, uncontroversial. I think, and I have to apologize because many of you may have joined today hoping for a break from COVID-19, but it serves as a really, I think, timely example of how nimble this market is. And again, also how it does make it very difficult for people to sort through the different kinds of information that are out there. So for the last couple of months, we've seen a lot of attention in the stem cell space around offering treatments and purported cures for COVID-19. This was perhaps no surprise to many who watch this field, because the stem cell market has proven to be very nimble over its lifetime. We've seen clinics move between jurisdictions, for example, when regulatory efforts tighten in one place. We've seen the way in which language is used on websites shift in response to, for example, warnings around some of the red flags that patients should be aware of. And here we've seen clinics maximizing on recent events. So there is, again, as was the case in MS, some interesting and I think very rigorous research that is being done on stem cells with respect to COVID, whether it comes to modeling the disease or on the more treatment or cure end of side of things, even on the vaccine piece. And yet there are also clinics that are offering treatments now purporting to either, as I mentioned, prevent or to cure COVID-19. So this is part of, I think, that what's being called the broader infodemic by the United Nations and others around COVID-19. But again, just as a timely example of the challenges people face in wading through all the different kinds and quality of information that's available online about health, about medical options, and about things like new treatments, including stem cell-based interventions. And the challenges here, I think, are particularly concerning for people when there are serious health implications associated with different treatment choices. So that's kind of the background. Now, I do think it's important to acknowledge that medical markets, unproven interventions of all kinds of varieties, travel for medical care, people pursuing treatment options or interventions outside their sort of publicly funded or publicly run systems are nothing new. These are trends we have seen for millennia. One thing that I think has really elevated these markets and sort of created more options for people, but also heightened the challenges associated with them, is the global nature of our world and the internet. The broad sharing of information, of movement of people, of cell lines, of products, of researchers across borders, has only served to sort of really, again, heighten some of the challenges that we face when it comes to some of these issues. Now, the stem cell market for unproven interventions is something that people have been watching. We've been researching it for over a decade. It's been a challenging field to research because, of course, there is no registry, sort of international registry of clinic providers of unproven treatments. You're not sort of required to report on that when you return, for example, from international travel. We don't thankfully monitor people's internet activity when it comes to their health choices, but that makes it difficult to really map the market in a systematic way. What we know about this market has been drawn from a wide variety of research approaches, including systematic analysis of clinic websites themselves, interviews with patients and providers, media reports, and sort of analysis of patient blogs and other communications of that nature, and all those kind of various pieces that we've brought together. In its earlier days, it was very prevalent in countries including China, India, and Mexico, but more recently we've seen an explosion in other jurisdictions, including very prominently the United States, also Australia, and to some degree Japan. As I'll come to in a moment, it's difficult, and I would suggest inappropriate, to sort of apply blanket statements overlay to this market as a whole, because there is a tremendous amount, and I think an increasing amount, of variation within the market. But some of the markers that we see many clinics offering a one-size-fits-all approach. So as I showed earlier, a very long list of conditions that are treated with the same kind of protocol, or purportedly treated with the same kind of stem cell protocol. They are typically on a direct-to-consumer basis, offered online, so not through the referral, for example, of someone's regular physician. And they generally are paid for out of pocket by patients, so not paid for as part of publicly funded systems, certainly, and often not covered by private insurance as well. And again, typically because they do not have that evidence of safety and efficacy. Now, for a long time, Canada sort of was a bit of an observer in this. When we talked about issues with respect to this market here domestically, it often related to concerns around our healthcare providers being asked to provide follow-up care when patients returned, or sort of struggles around how to advise patients interested in pursuing this elsewhere. But over the last couple of years, we have seen the market enter our borders as well. Research that started even as far back as 2017 was showing kind of between 11 to 15 clinics across our country, and there continue to be more, which is attracting the attention of our own regulators as well. So we are now in the thick of this with many other countries around the world. So what are some of the concerns with this market? As I mentioned, they're sort of one of the defining features with these treatments, although there are challenges when it comes to definition and terminology, but is that we are lacking that evidence of safety and of effectiveness. That's kind of the first big piece. There are also some serious questions around quality control. There often appears to be limited or no patient follow-up, as well as limited to no adverse event reporting, or certainly none that is transparent, unlike, for example, what we would see in approved research protocols for other kinds of experimental treatments, where if things don't go well, that needs to be disclosed. There are some real sort of, again, important questions around informed consent and whether patients are advised appropriately about the risks of the treatment, as well as about the unknowns. And there are, as I mentioned, the financial costs. Although I showed the one clinic that cites $20,000 US, again, research suggests that there is a broad spectrum of costs of these clinics, and many involve multiple treatments, as well as, in many cases, travel costs if people are leaving their jurisdiction of residence. And the list could go on. So these are just an initial sample. But of course, the most probably pressing concern is with respect to risk to the patients who do receive these treatments. And that concern flows largely from reports of adverse events that have followed these kinds of treatments, whether they range from infection, for example, is simply related to the way the stem cell was administered or the stem cells were administered, to very specific risks related to stem cells going awry, right? So where we have tumor formation or formation of cartilage where it's not supposed to be. And those really speak to some of those differentiation challenges I mentioned in my introductory comments about stem cells. So when we're using stem cells, but we don't know what we're doing well enough with them, they can turn into things we don't want them to, like tumors or like, as reported here, bone fragments in other places. So there are some sort of significant risks. And because it is a field that is relatively new in terms of clinical application, and when we're talking about uses that haven't gone through the usual research processes, we also have the unknown risks, right? Where we just don't know what the possible issues are. And those can be particularly concerning with something like a cell-based product, where you are putting those into a person and you can't necessarily get them out. So once they're in, they're there. It's not a drug that you can stop or a medical device that you can remove. So even those unknowns are something to be sort of alert to in this space. And those concerns run in contrast, though, to the language that we see on clinic websites. A lot of research has been done over the years, again, as I mentioned, analyzing the content of websites, offering these kinds of treatments. And it does tend to, again and again, we see that claims made tend to be overly optimistic, tend to downplay risks, tend to minimize questions around regulation or safety. The quotes on this slide are taken from some research of mine that is still unpublished that I've done with a colleague at the University of Saskatchewan, where we're looking at the text used on clinic websites here in Canada. I won't read all of these, and I won't expect you to either, but just to highlight a few, sort of these treatments are legal, safe, and effective. This liquid gold is injected into the area of concern. This technique is safe and there are no side effects. Some of these claims, I think, are probably surprising to many of you who may be familiar with the 3 pages of potential side effects you read in a bottle of Tylenol, right? Every medical procedure has potential side effects. So to claim there are none is certainly concerning. So if this is the sort of language that is piquing people's interest in these treatments and these interventions, without that focus on the potential risks, again, I think that is in itself cause for some concern. And it does contribute to what I like to call a murky market. And I think this market is gray for many reasons. I won't focus on this angle in this presentation, but from a regulatory perspective, there are some real challenges here, particularly because of a lack of specificity around information around what kinds of cells are being used, what administration protocols are being used, what the training and expertise is of the folks who are doing this. As I mentioned earlier, what the nature of information that's provided to prospective patients is. So that kind of all feeds into a bit of a challenge from a policy perspective. But for our purposes today, I think the more pressing issue is the murkiness for individuals and their loved ones who are trying to navigate this incredibly sort of confusing body of information that's available online and in the public domain and in popular culture around stem cells, around their promise, but also around kind of the concerns that might be there with respect to, and when individuals do try to sort of get out there and do their own research and try to find out what's real or what's not, sort fact from fiction, there are some challenges there too. This is work that I published a couple of years ago with some colleagues where we identified a number of what we call tokens of scientific legitimacy that are used by clinics. So in a nutshell, many of the websites that offer unproven stem cell interventions look great. They're very polished, they're very professional. They often refer to publications, although if one looked at those publications, they either are not published in actual peer-reviewed, scientifically credible journals, or they refer to publications that have nothing to do with the service really that they're offering in a precise way. And yet they're sort of a token of legitimacy, just as one example. But I have trouble sorting through that as someone who is not trained in the sciences. I'm a lawyer, I'm a social scientist, I'm not a stem cell biologist, and I can have trouble sorting through the claims made in some of these pieces or kind of trying to wade through what are legitimate and what are not. And I need to rely on scientific collaborators to help. And so I think sort of putting myself in the position of a patient and a patient's loved ones in often very distressing circumstances, trying to do that is, again, a real challenge. So that brings me to the kinds of policy options that we have seen employed in different jurisdictions to address some of these concerns. Now, I could spend an entire presentation on each one of these and have, but I won't, obviously, for the purposes of today. We're going to come back to the first on the list, which is information, but I will just briefly identify the others. And just noting that the reason I have this slide here is because with any policy choice in this area, there are trade-offs. And we have seen different combinations of these different options employed to varying degrees in jurisdictions around the world with varying degrees of success as well. And again, I think there are some really interesting issues there in and of themselves. We've seen the use of regulatory oversight and sort of efforts to either improve or tighten up regulatory regimes and to improve enforcement of them. We've seen the use of common law, so in other words, seeing people sue under tort when things have gone wrong. We've seen some use of consumer protection and truth in advertising regulation. This is an area that I think has a lot of merit and perhaps has been underexplored in many jurisdictions. And we've also seen to some degree the use of professional regulation, which is another research interest of mine, one that I think has some real potential in this field. But for our purposes today, we're going to focus on information, because we have seen almost countless, I'm sure I could count them, but a wide variety of different kinds of information-based responses to the concerns that I've mentioned. And these have come from many different groups. We've seen information coming from scientific organizations, from patient advocacy communities, from governments and other arm's length regulatory bodies, leading experts in the field, and others, and sort of even really grassroots social media kinds of initiatives. And really the driving force behind many of these is to help support informed decision-making by patients and their loved ones. So many of these kinds of initiatives focus on making information about stem cell research more accessible, more transparent, more easily understood, so that people can sort of understand, firstly, why it takes so long for research that seems promising to get ready for actual routine clinical use. Many of them also do focus on identifying some of the concerns with markets for unproven intervention and why one may want to think twice before going that route, or at least to be aware of the risks that may be involved in doing so. So these are just some of the pieces that we see, again, from all kinds of different directions. I think they have many benefits. They are they're non-coercive. They do support, in theory, informed decision-making, autonomy, these things that we value, right? And often in our medical decision-making frameworks. But there are some very real questions about whether they're hitting the mark, whether these kinds of efforts are providing the types of information, help, or support that people are really looking for. And it was those questions that prompted a collaborative effort that I'm now going to sort of focus on a bit more, that I was involved with, as I mentioned, colleagues out of both Scotland and Australia, where we were really sort of driven by this effort to understand what people's information-based needs are. So people who are actively seeking information or advice about stem cells or stem cell-related issues, what is it that they sort of self-identify as needing, or what is it they're looking for? And so this is the piece that I'll be presenting on now. It was just published earlier this year. The colleagues that I worked with from both Scotland and Australia are affiliated with first EuroStem Cell for the Scotland colleagues and Stem Cells Australia. So these are two largely publicly funded organizations. They have slightly different mandates. EuroStem Cell has a partnership with over 400 stem cell and regenerative medicine labs from across Europe. And they are very much focused on science communication and public outreach, so helping European citizens understand stem cells. They have an education piece. They have, as you can see on the top, aspects about medicines and stem cells. They're sort of a connective force. So that's what they do. And they do have ability for individuals to reach out to them directly through a contact us section. Similarly, Stem Cells Australia, although they have a fairly broad mandate and engage in different research activities in the stem cell and regenerative medicine space, also have that public engagement mandate. They seek to contribute to public debate and discussion and sort of, again, that educational piece. And like EuroStem Cell, they have that contact us piece on the top. Both of these organizations receive hundreds of unsolicited inquiries from members of the public each year. And so this seemed really fruitful as a place to start for understanding, again, what people are looking for. So we collected over 1,000 inquiries, over 542 to be specific, from Stem Cells Australia, and 505 from EuroStem Cells, received over 2 years. So from May of 2014 to 2016. I should note that these were English language inquiries only. So that is one limitation in this research because we did not have the expertise on the project team or the budget sufficiently to get the expertise to engage in translation from a broad number of external languages. So we focused on English language queries only. We then engaged in a content analysis. So our first step was to do a preliminary coding, which informed a quantitative analysis. So trying to get a sense of kind of the numbers, so how many people were interested in different things. And I'll talk more about that in a moment. And then our second step was a qualitative analysis, where we sought to identify dominant themes emerging from these inquiries. Our initial observation was how strikingly similar our results were between these data sets. So even though these two organizations do serve largely populations on different areas of the world, the results were very similar, which we thought was quite interesting. And it enabled us to really combine the data sets and visualize it as one collective data set. It may also, and again, I can't speak to this because it doesn't include, but you sort of, for future work, hypothesize about whether this does speak to some of the universal themes that connect people around the world who are interested in these kinds of areas. But we can't answer that without further research, which is always the next step. This next table here presents our quantitative results. Again, it's not important to read all of the specific questions. The left-hand side lists the questions that we developed for the coding frame, and these were based on other research in the area and our literature review. So these were sort of the initial prompts that we thought, again, based on other work, would be important to explore within the questions. And you can see we reported our results here on Stem Cells Australia, EuroStem Cells, and the total. Again, the specifics aren't important. You just might note as you kind of glance through the numbers, again, how close they are. They're often between 2 to 3 percentage points or up to 5 difference between the two sets, which again is interesting. With arrows, I have flagged just a couple of the points I'd like to draw your attention to. The first is that it was relatively evenly split between individuals writing on their own behalf, so as a patient, and those who are writing on behalf of someone else. usually, although not always, a loved one. So we had the odd case of a physician writing on behalf of a patient, for example, but most were friends or family members. And the reason I think that's important is it's a reminder to us as we think through policy interventions and as we think about crafting information and other supports and those kinds of tools, we can't forget about patients' communities, their support networks that inform their decision-making. And this is probably no surprise to many of you if you've encountered kind of patient and family-centered care exercises or frameworks, which is a really common language in our own healthcare system here in Saskatchewan now, and many others across Canada. But it's true here as well, right? That these other supportive individuals are clearly playing an important role in helping gather information that's being used to inform decision-making. The second piece is that about 70% of individuals were looking for treatment. They were looking for intervention, therapy, sort of action to treat a particular condition now. And we'll come back to some of the specifics around that in a moment. But they're not sort of seeking general information as much as the overwhelming majority are looking for an actual treatment. And 90% in the total, 90% plus, 93% for a specific condition that they've named in their request. So again, these are people are, this is sort of not general sort of amorphous ideas. They're concrete, in many cases, very much on a mission. So those were the sort of quantitative results, but I think the richness in our findings here is really in the qualitative analysis. And here's where we analyze the content of the different inquiries to pull out these different themes. For each of the ones I'm going to touch on now, I have included a quote that serves as an example. You'll note that there are some spelling and grammar mistakes in these, and that's because it seems apparent from many of the communications that a lot of the writers are not using English as a first language, and so we just kept all of any errors that were in the original in our published version. We felt it was important not to correct those to lose sort of some of that meaning. So of those individuals who were seeking information about sort of the specific stem cell treatment or intervention, there were three kinds of different themes that emerged within that kind of broader category. And the first is that people were asking whether these individual organizations, so EuroStem Cells or Stem Cells Australia, actually provide treatment or could treat them for their condition, and if so, how much would that cost? So they're sort of looking to these organizations as actual treatment providers, which of course neither of them are in any capacity. The second group is looking for information on where they should go for treatment. So advice or recommendations about particular physicians, about particular clinics, or about specific countries. You can see this example of an individual trying to find a clinic in Germany that uses stem cell therapy for hearing issues and looking for information or direction. And the third category is what I would emphasize, people wondering whether stem cells can help and would you recommend them? And a number of inquiries in this category demonstrated, I think, or reflected some of that challenge I spoke to earlier about navigating the information environment that we have out there around stem cells. So in many cases, these are individuals who had already done some of that initial work and sort of research, and I'm going to circle back to that a bit more in a moment, but were expressing some confusion or the need for assistance in navigating conflicting information that they had found, or looking for a reliable source that would tell them what they can sort of make of the claims made on different, for example, clinic websites. So this individual expresses, is your organization able to assist me or direct me to someone that can enlighten me on this new procedure and whether it's suitable for my condition? There are a number of sites on the internet, but I'm not comfortable with the information available, as there seems to be contradictions. So here, really looking, as I mentioned, for that source of reliable expert direction. Other information needs and priorities that we identified was an interest in the state of research for a specific condition. So again, as I mentioned earlier, it can be really challenging to sort of understand or find information about where research or legitimate research is in respect to a particular condition. And so people looking for that kind of guidance. There were also individuals looking to participate in a clinical trial. And here there were a few that were sort of interested in contributing to the benefit of science and the greater kind of good. But more, I would say, were looking for themselves or their loved ones to benefit from the research as a clinical trial participant. And that raises some concern in terms of clarity of understanding about the differences between research and clinical use, because research is not intended to benefit the individual participants. Some late-stage research participants do receive a benefit, but the focus is on benefiting future patients, on contributing to knowledge and to that research trajectory. And so, yet it's a concern when you see individuals like this particular one saying, I'm ready for a clinical trial, don't try it in animals, take me instead. And so this is sort of another category of themes that we identify. And finally, some general questions. So people asking things like, out of curiosity, how many lives can be saved from one baby's cord blood? And so the kinds of information that these organizations do provide very regularly about sort of general issues around stem cells, how they work, what does research mean in this area? So another observation that we made was just how highly emotive many of the communications were. So one of the things we looked for, or some of the things we looked for in our quantitative analysis, was the use of terms desperate and hope, because those are things that have been identified in future or previous research as being kind of a core motivator for individuals who pursue these private market unproven interventions. Although we didn't necessarily see high numbers of those specific words, we did find very emotional pleas, often sort of expressing things like, well, you can read for yourself here, but that people are at their wits' end, that they are looking for what they call their last hope. You can see some of the quotes here. We'd like to ask you, if you can save the life of our dream daughter, we'll be extremely grateful. You are our last hope. Please help us to save my father. We also found some that expressed pretty significant frustration with respect to domestic regulatory systems or healthcare systems, as is reflected in the last quote. So often that perception that regulation is holding back therapies that are available elsewhere, that would work, that are hopeful, for various potential reasons. And so again, just highlighting the sort of strong emotional state that many individuals are in, dealing with very distressing conditions, and really expressing a very strong need for some kind of support and help navigating through all of this. A few additional information, observations were our findings about a minimal focus on questions about risk or regulation. This was something, again, we looked for initially in our quantitative analysis, really didn't find much more in our qualitative piece. And this is where we thought we might see, we expected to find people interested in whether things were approved or not, or we really didn't. Now, of course, it's a limitation in this kind of research because we can only analyze the face of the information provided. So it's not to say that individuals reaching out don't care at all about safety or about risk or about regulation, but it wasn't enough of a priority to express it in their inquiry or in their sort of question that they were asking. There were, of course, a few exceptions, which are a couple of examples are here, wanting to know if it's a safe procedure, or the second one, whether it's approved for clinical use or human treatment. But again, these were very much in the minority. And then also just more broadly, again, individuals who were building on research that they had already done and looking for that corroboration or further detail, which does tie back to sort of the initial category I mentioned of those looking for advice or direction. And again, these are individuals who really have done sometimes it seems as though a significant amount of groundwork, trying to do their best to find out what is, again, legitimate, what they should be concerned about, to navigate the conflicting claims that they might find, but needing help to do so. And I think that's very understandable because, again, as I have already discussed, much of this information is contradictory and it is confusing and it is highly challenging to sort through what is credible and what is not. And so sort of people who are driven from that place looking for that expert and credible source of information. So that brings me to our key findings, I think, that emerge from this, and some thoughts about future research. First, that there is this desire, and I would say need, for tailored advice and individual guidance. So although these broader statements and broader, for example, patient booklets and websites and resources are great, I think, and they are important, there is clearly a need for something more, for that next step. We often suggest that that next step, or it's often been suggested that that next step is to be provided by patients' healthcare providers. So go ask your doctor. But the reality is that many clinicians are simply not equipped to answer these kinds of questions from their patients. They also may not be experts in stem cell research in these particular domains and able to provide sort of that off-the-cuff, up-to-date analysis of the state of research, or awareness of clinical trials, or familiarity with claims being made on a private market basis. So that's sort of one challenge. They also may simply not have the time, right, in their sort of schedules or their 7-minute treatment appointments to be able to do that. So there are some limitations there, and there's, I think, a need for something different. the importance of clear lines between research and treatment and clear communication about that. And this flags, again, back to where I noted many individuals were seeking or seem to be interested in participating in clinical trials for the benefit, which of course, again, is not the purpose of research. So I think that speaks to a need for all of us in the research community, a reminder to be clear about communications around trials, about when they are available, about what their purpose is, and reminders as well that they too carry significant risks. And so that's sort of a broader scope that is not only relevant to this field, but certainly it's important here as well. A need for more nuanced understanding of trust and distrust in both physicians and regulatory systems and how that influences individual decision-making around healthcare options. I already sort of mentioned some of the mistrust that came through in some of the quotes around regulatory systems. We also saw that around regular physicians, where individuals expressed hesitancy to talk about these questions with their healthcare providers, or an assumption that they would receive a negative response, or perhaps poor healthcare treatment because of sort of the ramifications if they indicated they wanted to pursue a different course of treatment. And that's concerning, right? Because these are the sort of healthcare providers that are there to provide that kind of care for their patients and who need to understand the full spectrum of interventions patients might be pursuing so that they can provide the appropriate supports. So we need to do a better job of understanding or do a bit more sort of deeper digging into how those forces relate and how we might better align them so that we can support patients in their decision making. And finally, I think there's an imperative to devise new ways of providing the support that people need while recognizing resource constraints. So, for example, these organizations that were sort of the seed for this particular research, they don't have the capacity already to answer all of the inquiries that they receive. It's not really their sort of key mandate, and they don't have the staffing and support to do so, and that's a real challenge. And there are only so many organizations like this that even do that at all. And sort of the concern that one brief email back or certainly a generic response is not going to be sufficient. So I think there's an imperative to think through how we can do this differently, what shape these services can take. I'm encouraged even in these last number of months by the innovation we see happening in healthcare systems worldwide in response to COVID-19 and our movement rapidly towards virtual care provision of different kinds. And I think that is a signal that we have the capacity to adapt and to be innovative in our options. Even us doing this virtually today speaks to, again, our ability to embrace new ways of doing things in a way that meets the challenges and the realities that we're currently facing. So again, I think there's hope here, but we need to spend some time thinking through what's most important in the strategies and how we can deliver them in a way that recognizes the limited capacity of healthcare systems really across the world. As always, there are limitations in any research, and certainly I acknowledge those here as well, including the fact that these were English language inquiries only. And I think perhaps most importantly from my perspective, it also ties to future research, is that we did not follow up with these individuals. It wasn't a possibility in this sort of data connection world to be able to follow up to see what these people did with the information or advice they were provided. So they sent their initial inquiry, individuals from these organizations responded. What did that do? Did they take that advice? Did it shift their decision making? Did they ultimately pursue an unproven intervention or not, and why? So I think that is an avenue that we really also need to explore before we can devise strategies that are likely to be effective. So that's a really important next step piece. And with that, that brings me to the end of the time for the presentation. I do really want to acknowledge my collaborators, Megan Munsey, Claire Tanner, Jan Barfoot, Claire Backburn, Anna Portier, who are my co-authors on this particular publication. Work I spoke to earlier in the presentation has been built on projects done with any number of other valuable collaborators as well. I also want to acknowledge that parts of this research were funded by the Stem Cell Network and also by a University of Regina President's Research Seed Grant, for which I am very grateful. So thank you for your attention today, and I would be happy to try my best to answer any questions that you might have.
Thank you, Amy. That was incredible, and I echo the comments within the chat field that you've done such a great job of encapsulating such a broad and interesting field. I'm just gonna give you, I guess, a quick chance here to catch your breath. And Kylie, do we have questions queued up for Amy?
Okay, so I see one question about where are major Canadian centers doing stem cell research and what the situation is in Saskatchewan. you know, as Canadians, I think we can be very proud of our role in this field. We have, although we're sort of a small population, it's often said that we punch above our weight when it comes to international progress in this area, and we always really have since the beginning of the field. So there are many very talented stem cell researchers in this country who are leading the way in a number of different fields. Too many to list in this particular presentation, but the Stem Cell Network, which is a funding organization, it started as a National Centers of Excellence a number of years ago, and now has received direct funding from the Government of Canada and others, is probably one of, if not the major funder of stem cell related research in Canada. And they have a very accessible website that it does a great job, I think, of featuring and highlighting different areas of research going on in the country. So if you're curious, I would suggest you visit the Stem Cell Network website, and you'll be able to take a look through and get some examples of the different kinds of work being done really coast to coast here in this area. Everything from sort of very early stage exploratory research to clinical trial work. So there's certainly a lot of interesting pieces to look at there. We also, again, and here in Saskatchewan is no exception, we do have some interesting researchers, even including some within the Faculty of Science here at the University of Regina who are doing work. Dr. Joseph Butig is one who comes to mind, who has done some work in MS and other areas. So again, really, there's a lot going on in Canada, which is great. Question: have I found a stem cell therapy that has been confirmed by medical science is useful? So yes, as I mentioned, there are a few treatments that are well established now and used routinely. I think probably the most commonly known are transplants for leukemia, so bone marrow transplants. That's a form of a stem cell treatment. Stem cells are also used with success, for example, to treat different kinds of burns in some cases. There are some successful applications with respect to ocular disease, so diseases in the eyes. And then there are kind of a range of different trials worldwide that are in more advanced stages. So where there are some, I think, significant hopes for progress. But yes, there are already certainly some established stem cell treatments, and that's why sometimes I can feel that it can lean towards the negative to talk about the concerns of premature application, but I don't want to sort of discount, I think, the potential value of the field. It's just sort of with that caution and that realism that recognizes the challenges of this research and of clinical translation, and sort of why that can be seen to take so long, which of course the wait can feel really interminable for patients and their loved ones, especially if they're dealing with either a condition for which they may ultimately find fatal, or which has a very negative sort of effect on their quality of life. Another question, can I say more about where stem cells are taken from? Yes, and so I mean, again, this is where we could do a whole talk simply on that. There are a number of different kinds of sources. Embryonic stem cells are drawn from early stage embryos. And of course, that's often what comes to mind for people first when we talk about stem cell research, because they are so controversial. They have been sort of challenged from the beginning of the field, largely from communities or perspectives that feel the embryo has a life, and so destruction of embryo is unacceptable for ethical or moral or religious purposes. So that has been a sort of a defining feature of the field in some jurisdictions, and that is sort of an issue, again, with respect to balancing some of the benefits of the research with how, from a policy perspective, for example, we navigate those concerns that tend to be fairly intractable as well. Another source of stem cells you might have heard about are called induced pluripotent stem cells, or iPS cells. And these got a lot of excitement in 2007, derived first by Yamanaka out of Japan. And the reason I think they generated so much excitement initially was that they are an adult source of stem cells. So initially they were taken from, the ones used were taken from skin and genetically reprogrammed to act like embryonic stem cells. Not necessarily perfectly, lots of debates around sort of whether they could completely replace the use of embryonic stem cells or not, and we don't have time for those today, but a lot of promise and excitement with that kind of stem cell, because they are, again, pluripotent in that they can become lots of different kinds of cells throughout the body. We find cells in blood cells and skin cells and muscle cells. Again, those are more adult types that are more limited in what they can become. You might hear about fetal stem cells, so taken from fetuses or umbilical cord. So again, I'm sorry that I don't have time to sort of go through the science of all of those, but I do wanted to stress in the beginning that there are multiple sources and they can do different things, and that is sort of an important piece. And when it comes to the claims made on clinics, for example, that's important because different kinds of stem cells and different application techniques also have different risks. So that's, again, it's, even if we can't get into the specifics today, I do want to leave with the message that the differences do matter, and that's something to kind of be alert to if this is an area that you're looking into in more detail. A question about why are clinics offering these stem cell services not being affected as a result of lawsuits? I think that's a great question, and a bit of a sort of big question, so I hope I can address it here. We have seen, for example, south of the border, where they are often more litigious in medical areas than we are here in Canada, some use of, as I mentioned, tort claims, so people suing often for negligence if they're hurt as a result of stem cells, and that has had some success. However, the research would seem to suggest that there are lots of claims being settled out of court, and of course that information is not always publicly available. So I want to sort of speak to two aspects of that. The first being, I think, it's my sort of view from a health law perspective that individual court cases, so civil lawsuits, are not the place for regulation. They're not a replacement for appropriate regulation because they don't do, I think, a very effective job at either addressing harms on a broader scale, or certainly as acting sort of setting the course from a policy perspective. They place a tremendous burden on individual patients who are often disadvantaged from a capacity perspective, from a financial resource perspective, and they ask someone who is injured to sort of bear that burden of driving a medical case forward, which can take a lot of time and be very expensive and be very stressful, have very uncertain results. And unfortunately, even though I am a lawyer, I can say that often the outcome of cases doesn't necessarily mean it's sort of the right answer. It might be correct in law, sort of, and courts are constrained to a large degree, but it doesn't always provide a satisfactory result, again, from that sort of policy perspective. And I think the same is true here with respect to stem cell interventions. So it's limited in the civil law ability to sort of be a major player when it comes to affecting what does and doesn't happen at a broad level. Regulation is also, I think, an area worth focusing on when it looks at how these clinics are regulated in different jurisdictions. We've seen the FDA in the United States be quite proactive in the last number of years in terms of setting warning letters. They've been tightening their regulations and promising stricter enforcement. There are capacity issues, though, when it comes to dealing with this, even in terms of the sheer numbers of clinics and the online nature of the advertising, and even of sort of their ability to sort of move between different jurisdictions where you're not even sure always where the physical presence is, does create another challenge too. Here in Health Canada, I don't know if you maybe noted on my information slide, there's a piece at the bottom that Health Canada has issued now some guidance around this, clarified their perspective, that certainly some of the treatments that are being provided in Canadian clinics are considered drugs. They do fall under the authority of Health Canada under the Food and Drugs Act, and they should be regulated or are regulated accordingly. But again, enforcement is another issue. So it's a complex area, but certainly a very good question, and thank you.
Thank you, Amy. As we come up to 1 o'clock here, I think that gets us through all the questions. So I'd just like to take a final moment to thank you again for your presentation today. So informative, and the depths to which you could go within this subject are likely boundless. I'd like to also thank the Lifelong Learning Center for partnering with the University of Advancement and Communications, and Kylie for monitoring or moderating this session, as well as Diane Mullen from our alumni engagement team, who has been helping to be able to promote and put on this incredible research with impact series, not only this year, but for the last 3 years. And finally, thank you to all of you for joining us today and for participating, taking advantage of this new way to be able to engage and participate in these types of sessions. We're very proud of all of the research that happens at the University of Regina and the incredible researchers who are doing that work. A video of today's research with impact will be posted to the alumni section at uregina.ca/alumni, and will be shared with you within the next few days so that you can view it at your leisure. Feel free to share that link with your family and friends and to help them to be able to also learn about the great research that's happening at our institution. Thank you for joining us today, and don't forget to register for the final 2 presentations in our Research with Impact virtual lecture series. First on June 16th, Surfing Troubled Waters, Mindfulness for Mood Management in Uncertain Times with Shadi Bashai, Associate Professor in Psychology at the University of Regina. And our final session on June 23rd, Planet 9, Discoveries in the Outer Solar System with Sam Lawler, Professor of Astronomy at Campion College in the Department of Physics at the University of Regina. Until then, be safe, stay home if possible, and practice social physical distancing when you can't. Have a great day.